Hi, my name's Holly. Welcome to 5 Minute First Classes. Today we're talking about diabetes in pregnancy, which is also called gestational diabetes or GDM. Now, GDM affects about 1 in 10 pregnant women here in Australia. If you want to hear more about the testing for that, go into my previous video, which is all about 28-week bloods and gestational diabetes screening, and I go through that there. Now, there's some people that will actually be asked to do their diabetes testing or their GTT earlier in pregnancy, usually at the end of first trimester, about the 12 to 16 week mark. So if you have any risk factors that increase your chance of having diabetes in pregnancy, or like especially the increased insulin resistance, which is what causes diabetes in pregnancy, then you might be asked to get some testing earlier. So risk factors for this include if you've had diabetes in pregnancy previously, if you've had a previous baby over 4 kilos or a baby with like significant abnormalities, if you have any strong family history of diabetes, especially first degree relatives, so children, siblings, and parents, really, really important. If anyone has diabetes or had GDM, we will ask you to also get some early screening for that. If you have any ethnic background, and there's going to be a lot of things on here that, like, please do not hate on me for this. This is just the guidelines. So ethnic background, which includes Asian, Indian, Maori, Pacific Islander, Aboriginal, and Black African, or slightly higher chances of diabetes in pregnancy. Also, if you're over 40 years old when you're pregnant, or if your BMI is over 35. Now, there's also some of us who have polycystic ovaries or PCOS. So that automatically increases your insulin resistance anyway, which in pregnancy increases again. So early screening for that is also ideal. And for anyone who's taking steroid medication or antipsychotics, that can also affect your body's metabolism of blood sugars. So these are all things that you might be asked to do an early glucose test based on. Now, for people who are diagnosed with diabetes in pregnancy, it's just a temporary status, and it's not related to your pancreas or your insulin levels. It's actually related to the fact that your placenta is pumping out pregnancy hormones, which make your body work harder to use the insulin. So it leads to this temporary state of insulin resistance, which is what causes the temporary diabetes in pregnancy. For most people, it can just be controlled through diet and lifestyle. So here in Australia, if you're diagnosed with GDM, very, very quickly you get a referral to a dietitian and to a diabetic educator. And so these people will go through with you, like, what is your normal diet? What can you make changes in? How can we reduce the glycemic index of a lot of your foods to reduce like high blood sugar spikes? As well as then also talking about blood sugar control, what's a normal level, like post meals and fasting, how to do like your own testing of your blood sugars. Here's a machine, here's everything that you need, and they check in on you a couple of times a week. Now, for most people, diet and lifestyle can control this. Every now and then, the pregnancy hormones just get out of control, and so the insulin resistance increases more than what your body is able to manage, and so tablet or injectable medication, so insulin, is required to help with blood sugar control. Now, because your blood sugar, your sugar is going to every part of your body, including across the placenta and to your baby. So the two big problems that we're looking for is if your baby's growth is abnormal, especially getting bigger, and then once your baby's born, if they're going to if they're used to having high blood sugars coming from you, they're going to have a lot of trouble stabilizing their own blood sugars, especially in the first 24 hours, which means that they have blood sugar drops or hypoglycemia. So there's a couple of things that we're trying to address and control as much as possible. Thankfully, the good news is once you have your baby and the placenta is out, that almost always ceases, and no more diabetes. Yay!